Yes.
Hello, sir.
Hello.
Let's start. Hello.
Hello.
Shall I start, sir?
Yeah, please, ma'am. Yeah.
Okay. Om Shri Dhanvantare Namaha. Om Shri Guru Vasavalingaya Namaha. Very good morning to one and all, and a warm welcome to Kumara Bharana 2020, a national webinar series on Kumara Bhrutya. So today we have an eminent speaker, Dr. Udaykumar, with us. Now let me have a privilege of introducing today's guest speaker. Dr. A.N. Udaykumar, sir, completed his graduation from Sri Jayendra Saraswati Ayurvedic Medical College and Hospital, Chennai, and MD from DGM Ayurved Medical College, Gadag, in the year 2006. Sir has 14 years of clinical practice in the Department of Komarabhrutya and has been invited as a guest speaker in many webinars and state-level seminars. And sir presented many papers in international and national conferences. And presently, sir is pursuing PhD in Komarabhrutya from SVM University, Kanchipuram. And sir is a head research committee of STS Ayurved Medical College and Hospital, Chennai, and presently working in the same college as associate professor and HOD Department of Komarabhrutya. And sir is having a special interest on pervasive developmental disorders in children and muscular dystrophy. And we are happy to have you with us, sir. And just before I hand over mic to the guest speaker, there are a few instructions to the participants. Please mute your audio and video while joining, and display your full name. And if you have any queries, you can drop them in the chat box, which will be discussed at the end of the session. And if you have any disruption, please wait for, if there is any disruption, wait for resume of the network. And thank you, sir. And now I request Dr. Udaykumar, sir, to carry forward this webinar and give his insight on the topic, understanding autism and Ayurvedic perspective and its practical aspects. Thank you, sir. And you can continue, sir. Over to you, sir.
Thank you for the very elaborate introduction about me. Good morning, one and all. I'm highly privileged to be part of this Kumara Bharana 2020 program. And let me give my insights or my understanding of autism in our routine clinical practice. The reason why I have chosen autism is one of the most upcoming disease or increasingly prevalent disease in the present era. Before, autism was very, very rare, but right now, whenever you say you are practicing Ayurvedic pediatrics, then automatically you will have cases similar to that of autism, Aspergers, all these conditions. around 20 to 30% of our clinical practice will be based on these type of diseases, developmental disorders or pervasive developmental disorders. So I have chosen this topic as autism. Unlike I have chosen autism as today's webinar topic. So at the end of the session, you should be, or my aims of this session is, you need to understand what is autism and what is autistic spectrum of diseases or autism spectrum of disorders. What are the other conditions which mix or which resembles similar to that of autism? All these things you need to understand. The second aim is early diagnosis of autism. You should be in a position to diagnose, or you should be in a position to say the child is not normal, the child is abnormal, is having some developmental issues. Okay, so early diagnosis of autism is usually neglected, especially Indian pediatrics. Usually a child should start babbling. Babbling is producing some sort of sounds. Some sounds that should be done at the age of 6th month onwards. Suppose if the age doesn't babble, even after 1 year, then automatically parents will get tensed and take the child to the pediatrician. So at that time, usually Indian pediatricians, what they will do is they will reassure. They will say that it's not, it's everything is normal, and don't get worried. It might be because of if mother and father both belonging to different languages, then automatically language development will be delayed in children. So like this type of things, a pediatrician can reassure. Yeah, hello.
Sir, can you make it full screen, sir?
Yeah.
Slides.
So this type of reassurances will be given for the parents, and they will neglect early features of autism. And this is very, very common in Indian pediatricians. So we need to diagnose the case, this type of abnormalities at the early stage, so that we can start the treatment and better prognosis. So third aim of dealing, this topic is you should develop confidence in handling children of autism. Okay. See, I will tell my experience. One child, Mr. Master Madhavan, he was aged around 8 years. When he came into the OP, he walked into the OP for the first time. He immediately sat on my lap. For the complete 1.5 hours of consultation, usually autistic children take around a minimum half an hour to 1 hour consultation. So during the entire day, the child was on my lap, or the child was on the consultation table. He never sat on the examination chair or the patient's consultation table chair. Okay, so when you encounter this type of cases for the first time, the people who doesn't know anything about autism, they will get frightened. Oh, why the child is behaving like this? So you should develop the confidence in handling children of autism. And the fourth aim is you need to have a better management of an autistic child when compared to your peer group of doctors. You should be in a position to manage in a better way. Okay, so these are the 4 aims and objectives of my presentation. So it is autism. You all might have heard about this word autism. It is a part of pervasive developmental disorder. What do you mean by pervasive condition? Pervasive is nothing but which is abnormal. Normal child and abnormal child. A pervasive is, the word meaning of pervasive is abnormal, deviation. So abnormal developed child is nothing but autism. And it is one of the most distressing condition for parents. Around 90 to 95% of the parents who comes with autistic child to the OP will be highly emotionally drained they will have, they might have lost hope. They might have, they might be emotionally drained, and they will start crying in front of the physician itself, because of the state of the child. It is most distressing condition. Okay, and this condition was first developed or first mentioned by Dr. Canner. He's an Irish physician in 1943. The same year, in the 1943, in India also there was one case reported in Darjeeling. It was reported in Darjeeling by again an Irish physician, by Mr. Ronald, Dr. Ronald. Okay, he has mentioned case report, but of course he has not. They have used the autism. They have, used a word called as a abnormal child. Okay, autism word was coined in the later years, but they have first seen the symptoms in the 1943. Initially, it was seen as a type of Aspergers. There is one condition called as Aspergers disease. It is a type, or it is another version of schizophrenia. You all might have heard about this word. This disease called schizophrenia. Okay. In schizophrenia, the another portion, there's like what to say, it's a type of schizophrenia. There is Asperger's. So in Asperger's, like the symptoms, the child will mimic. Okay, he will not have eye contact. He will not mingle, or he will not play with the other children. All these features will be there. So that conditions of Asperger's, that is autistic psychopathy of Asperger's, and presently it is called as autism spectrum disorder. So in the last 70 to 80 years, we have traveled a lot. This disease has traveled a lot. And it's a review, disease review and management studies. All these things have been changed from autistic psychopathy of Asperger's to autism spectrum disorder. And many people think that because the child doesn't have contact, or if the child doesn't play with others, then automatically people will think that if the child is having some psychiatric disease. No, it is not a case of psychiatric disease. See, any brain disorder is of two varieties. One is neurological disease, and second one is psychiatric disease. Both are different. Neurological disease examples are stroke, hemiplegia, Parkinson's disease, all these things. Okay, whereas a psychiatric disease examples are OCD, okay, schizophrenia. These all comes under psychiatric disease. This is psychiatric disease. Okay, stroke, Pakshagatam, Kampavatam, Parkinson's, those conditions, those are all neurological disease. Okay, any nervous system disorder is of two varieties. This autism is neurodevelopmental disorder. What do you mean by developmental disorder? Any disorder where the symptoms will improve, in the sense the child will have lesser symptoms, or the child will have reduction of symptoms as the child grows. As the child grows, the child will have improvement. That is called as developmental disorder. So this is the definition of a developmental disorder. There will be disease regression, not disease progression. Okay, in neurological disorder, normally there will be disease progression, in the sense initially there will be loss of function of upper arm, and then after 1 month there will be loss of function of lower limbs. Okay, so this is a progression, disease progression will be there. But in developmental disorder, there will be disease regression. Initially the symptoms will be severe, and as the age advances, the disease symptoms comes down. Okay, that is called as a developmental disorder. So this autism is a neurodevelopmental disorder. So this this picture is a picture of one of my patient. He's from UK. He's an Indian child, born to Indian parents, settled in UK, and they have come here for treatment. If you see the abnormality, this picture was taken during graduation day of their kindergarten. From primary LKG, from there they have graduated to next higher classes. So during the graduation day, they have taken this picture. So whenever during graduation day, they will usually cut the cake cutting ceremony. So whenever cake cutting ceremony is there, the first thing which the first set of people who gets highly excited will be children. If you see, all the facial expressions of the children is joyous, is happy. They are looking at the cake and they are smiling. But if you see this particular child, I hope you are able to see the cursor, movement of cursor. This child is not looking at the he's separate. He's not in the among the kids. He's separate. Okay, so the child is not enjoying, or he is not himself associated with the circumstances or the present circumstances. So all the children are involved, but only this child is not. Okay, the same child. Okay, and all the children that they're posing for the photo, but the teacher is finding difficulty in making the child stand in one place. Okay, the child is not relating himself to the situations. See, whenever photographs asked the child, like asks us to give us pose, automatically we'll stand erect and we will pose for the picture. But this child is unable to understand that one and is finding difficulty in getting himself associated with the present situation. Okay, the same child. Okay, see the facial expressions and of the child. The child, if you see the expression, it is completely vacant expression. There is no emotion involved in that. Okay, and this is the same child. When he came to India for the treatment, he has come to our hospital for treatment. We have done for this child. This is a child, and we have done Shiromundana. Okay, we have done a complete shaving of the head for Takradara. Okay, and if you see the abnormality, the child, this is the child. This child is not playing with the another child. Okay, there are two children. This child is not playing with this child. He's playing for himself. And if you see the arrangement of toys, all the toys have been arranged in a straight line. Okay, normally when kids are there at home, if you see a single toy, for example, if you take an example of a toy of an elephant, which can be dismantled. At the entrance of the house, the head of the elephant will be there, and in the bedroom, the trunk of the elephant will be there, and in kitchen, the legs of the elephant will be there, and in the bathroom, the body of the elephant will be there. That is the toy will be dismantled, and it is thrown all over this is how children usually plays. Okay, but if you see the child, he has is arranged the toys in all the toys in a linear fashion. This is one of the features of autism. Okay, this is the same child for whom we have done Takradara. Okay, and coming to the signs of autism, that is, he will be inability to relate to other, that is lack of peer relationship. If you see this child is autistic, and both the children are playing with each other, but this child is not playing. He is having difficulty in mingling with the people. Lack of speech will be there, or poor speech will be there, and they will have oversensitivity to sound. There is one child whose name was Dwarakesh. He used to come from around 1 hour distance from our hospital. He was staying in a different place, a distance of around 60 kilometers. Both train and bus facility was available for them. to reach our hospital. Whenever the child travels in bus, child, he shouts, he screams. Whenever driver gives horn, bus horn, okay, by hearing the horn, the child screams. But the child will be silent whenever he travels in train. He doesn't scream whenever the train produces that horn. Okay, they will have some oversensitivity to sound. Okay, and they will be having difficulty with changing the routines. And this condition, that is hyperactivity and passiveness, I have said in the beginning, that is a child, Madhavan, the complete consultation period was done on my lap. Okay, he was very hyperactive. He keeps on changing, sitting on my lap and jumping onto the consultation table, running here and there. All these things were there, hyperactive. Okay, and lack of awareness of danger. When you're taking these children onto the road, that is when you're taking them for a walk, usually children will hold the hands of the elders. But these children, they will suddenly throw away the hands of elders and they will start running onto the road. Hello? Hello?
Yes, sir.
Am I audible?
Yes.
Am I audible? Okay, yeah. And the next feature will be inappropriate laughter. Some children, they will keep on laughing loudly, or they keep on crying. And other symptom will be whenever you hug the child will start crying. They will be oversensitive to touch. Okay, and wherever eye contact will not be there. If you see these children, there is no eye contact. Okay, there is no eye contact. Okay, so lack of eye contact will be there. One of the main important features of autism. And there is one criteria for assessing autism called as DSM-4. That is called as Diagnostic and Statistical Manual of Mental Disorders. Diagnostic and Statistical Manual of Mental Disorders. There are 3 points in that. Okay, one is social interaction, second one is communication, and third one is behavior, interests, and activities. First one is social interaction, communication, behavior, interests, and activities. So coming to social interaction, again, there will be 4 sub-points in that. Out of 4, minimum the child should have 2. And coming to communication, again, there are 4 sub-points. Out of 4 sub-points, the child should have minimum 1. And behavior, interests, and activities, again, there are 4 sub-points. Out of these 4, child should have minimum 1. Minimum. So total is 12 points, 4, 4, 4, 12 points. Out of 12, the child should have minimum of 6 points. And this 6 points should be there for a period of continuously 3 months. Continuously 3 to 6 months. Okay. And these 6 points should be there both in school and also in home. When they are at home, also the same behavior should be there. And when they are at school, that also the same behavior should be there. Okay, what are those? That I will tell you. Marked impairments in use of multiple non-verbal behaviors. What do you mean by non-verbal behaviors? See, without any talking, you are communicating with a child through gestures or through some actions. You will say hi, I mean like you will say bye-bye. So the child will say bye-bye. Okay, we'll just wave the hand and the child will wave back. This is a non-verbal behavior. Okay, and failure to develop peer relationship. The child will not be in a position to play with the other child, and lack of spontaneous seeking to share enjoyment, interest, and achievements. See, whenever any relatives comes to home, children, if the children, what they will do is they will bring their achievements, any medals, any trophies which they have got in the school. They will come and they will show it to the guest. So this, they will feel proud, but this thing will not be there in autistic child. Okay, and lack of social or emotional reciprocity. That is, when you smile back, the child should always smile. Okay, normal. That is, when you smile, the child will smile back. This is called as emotional or social reciprocity. But these children will doesn't have this social or emotional reciprocity. Out of these 4, minimum the child should have 2 points. Communication, delay or total lack of spoken language. If spoken language child is able to speak, but other features of autism are there, then that condition is called as Asperger's disease. Asperger's disease. So Asperger's disease is nothing but child, autistic child who can talk. That is called as Asperger's disease. And second point is inability to initiate or sustain a conversation with others. Stereotyped or repetitive use of language. This is very, very important. That is called as echolalia. 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 That is, suppose if you are asking the child, "Hi, where are you going?" The child will repeat the same, "Hi, where are you going?" If you ask the child, "What's your name?" The child will reply, "What's your name?" Normally, when you ask a child, "What's your name?" the child will reply the answer, "My name is so-and-so." Okay, which class you're studying? I'm studying in the 2nd standard. So these are the question and answer. Suppose if you ask the autistic child, which class you're studying? Suppose if the child has developed speech, the child will say, which class you're studying. Okay, like a parrot, how a parrot repeats the words, like that repetitive use of language will be there. And that is called as echolalia. Echolalia. That is like a echo, like how our words itself will be an echo. Like the same way, the child will use the same terminology to us. Okay. Lack of varied spontaneous make-believe play and social imitative play. See, what do you mean by social imitative play? See, if there's a girl child aged 5 years or 6 years, what she does is usually she takes dupatta of mother, wears like a sari and starts take a small broom and starts brooming, okay, the floor, because the child keeps on seeing the activities of mother, and she tries to imitate the actions of mother. This is called as imitative play, social imitative play. Or if they have a Barbie doll, especially girl children, they will do makeup for the Barbie doll. They'll keep powder and all makeup, and they will make the doll lie on their lap and do this. What is it? They will play as if they are trying to make the doll sleep. So these are the actions which usually mother does. They keeps on seeing that one, and this is called as imitative play. And imitative play will not be there in autistic children. So out of this 4, minimum 1 point should be there. And behavior, interest, and activity, again, preoccupied with one or more stereotyped restricted interests. That is, they will have a repetitive interest. Okay, the same thing they keep on doing again and again and again. Okay, so this is about these 4 points. And again, I don't want to go into details. Next one, that is called as autism spectrum disorders. See, what is autism and what do you mean by autism spectrum disorders? Autism is a part of autism spectrum disorders. That is, it's a group of disorders. Okay. Autism is very, very common. All this time we are discussing about autism. Asperger's disease is nothing but all the features of autism will be there except talking. Asperger's disease, in the children of Asperger's disease child, will be frequently talking, will have a talking capacity, but autism children cannot talk. And Rett's disorder, it's a genetic disorder seen only in female child. Okay, this main symptom will be like the child will, when the child is standing in a normal, that is in the hands, in the normal posture, the child will be completely normal. Suppose if the child flexes the hand and brings near to the chest, okay, near to the midline, that is chest, automatically the hand or the wrist, it starts moving. Okay, in the sense it starts breathing, like how whenever the person will have pain, how the child jumps and like there will be a movement of wrist, like that the child will develop this one. Rett's disorder, it is a very, very rare disorder. My 14 years I've seen only 2 cases of Rett's disorder, and there is no much improvement seen in Rett's disorder. And the child disorder, this one is that is till 3 years or 4 years, the child will be absolutely normal, and suddenly the child starts developing features of autism. That is called as childhood disintegrative disorder. That is, whatever the milestones he has achieved will be lost slowly. Okay, and PDD-NOS, that is pervasive disorder, not otherwise specified. It is a mild feature of autism. Okay, and coming to the assessment of how we'll assess, that is by MCHAT questionnaire and the childhood autism rating scale. I'm not going to details. There are 30 questions in MCHAT. Almost all questions will have negative answer. That is no. The answer will be no. If the answer is no, then the child is normal. After 20, only 2 questions will have answer of yes. Okay, so 0 to 2, that is more the negative answer, the more possibility of the child is normal. Okay, this is MCHAT and childhood autism rating scale. I'm not going to the details of it. You'll get in the internet. If you just Google it, you will get all the things. And coming to red flag signs, that is the child if doesn't smile by 6th month of age. Okay, that is a danger sign. Okay, and by 9th month of age, if the child doesn't mimic sound, suppose you are doing some sort of sound in front of the baby, the child will start repeating the same. It tries to mimic. Okay, if you are smiling, the child should smile back. If that is not there, 9th month, that is a danger sign. No babbling by 12th month. The child should produce some sort of sound. If the child doesn't produce by 12th month, then there is a problem. Usually babbling will be seen by 6th month. If babbling is not there by 6th month, again, you need to reassess by 12th month. And if the child doesn't show any gestures by pointing, showing or reaching, suppose you're holding the child on in your hands. Okay, the child sees some toy, the child will call you, I mean will tap you and point fingers towards a toy. Okay, this is a normal thing. So if the child doesn't show that one, okay, that is a danger sign. And no words by 16th month, like this, all these red flag signs are there. Okay, by these features, if the child is having these features, then automatically there's some danger signs. And coming to the what are the structures involved, that is cerebral cortex, amygdala, hippocampus, basal ganglia, corpus callosum, and cerebellum. Okay, these are the structures, brain structures involved. And cerebral cortex, one of the main actions of cerebral cortex is it gives it is helpful in mental functions, higher mental functions, thinking, talking. These are higher mental functions. Okay, that is possible only through cerebral cortex. Amygdala is responsible for emotional responses and including aggressive behavior. Okay, and corpus callosum, this is a small layer which connects both the cerebral hemispheres. Okay, so transfer of information from one hemisphere to another hemisphere happens only through corpus callosum. If that is not there, then distraction, brain communication will be there. Okay, proper communication will not be there. Okay, so like this, different brain structures are involved. All these are theoretical one. Let me give some Ayurvedic insights with the recent advances. See, whenever this autism is one of the most researched topic in the entire childhood disorders. Okay, next from apart from autism, the highest number of researchers taken place Okay. Research which have and in understandable or in what way it is understandable in Ayurveda. Knowing this, if you don't know how this works in aspect in so the first thing is microbiota gut brain, that is called as gut brain theory. You might have heard of brain theory. Okay, in microbiota, that is in the
ಸ್ವಲ್ಪ ವೇಟ್ ಮಾಡಿ ಸರ್ ಇಟ್ಸ್ ಕ್ಲಿಯರ್ ಸರ್
Please wait for a while. So the speaker is rejoining. Wait for a while. Hello, sir.
hello.
Hello, sir. You can continue, sir.
Yeah. Okay. So, am I audible?
Yes, sir.
Okay. So, in the intestine, there are 20 times more than, 20 times more number of microorganisms than the number of cells, total number of cells in the body. Okay. And this bacteria, it maintains the equilibrium in the intestine. And this bacteria, it maintains the gut climate, and also it keeps on influencing the what to say, mood or brain actions. See, I will tell you there are many examples. For example, when you are attending a Viva OC, how you feel? You feel that there is excess acid secretions in your stomach. Definitely, the examiners will be having, whenever a student approaches the Viva OC, whenever he's entering this Viva, will be tensed, because for which question, what answer he will be giving. Okay, so jokes apart, normally whenever you're exposed to a particular situation, you will be tensed. You're approaching a person, okay, special person, automatically you will start that feeling of butterflies in your stomach. So all these things is possible with the presence of this microbiota. It's a bidirectional one. If there is stress, if the person is having stress, automatically it will alter your stomach or GI tract. If GI tract is not there, then automatically it affects your mood. It is like a bidirectional one. Okay, so in autism, this is very, very important. Okay, and dysbiosis in microbiota. See, these microorganisms in the intestine will have a symbiotic approach to the human body. If there is any abnormality in the symbiosis, then we'll call that condition as dysbiosis. Okay, it's called as dysbiosis. So, whenever there is a dysbiosis, that is abnormality of the microorganisms. So, what it does is the intestinal layer or the intestinal wall, it becomes semi-permeable. It becomes semi-permeable. So when it becomes semi-permeable, automatically whatever the intestinal fluids or intestinal metabolites which are there in the human, it leaks to the outside and it escapes into general circulation and it reaches the brain. When it reaches the brain, it alters the mood. It alters the behavior of a person. Okay, this condition is called as dysbiosis, and we call it as leaky gut. We call it as leaky gut syndrome. Okay, this is very, very important. This leaky gut in autism is very important. And the next one is mitochondrial dysfunction. Each cell will have a mitochondria. The mitochondria is nothing but the energy resource for that particular cell. Okay, the highest number of, or the huge number of energy which is taken by human body, that is heart and brain. These two organs receives or utilizes majority of the energy, okay, apart from that is heart and brain. So whenever mitochondria damage takes place, we call it as dysfunction, mitochondrial dysfunction. Mitochondrial dysfunction is one of the main samprapti or pathogenesis in autism. So mitochondrial dysfunction, it can be understood on the lines of Agni Chikitsa. Okay, it should be understood on the lines of, again, that is, you give Agni. Here Agni means doesn't only on this mitochondrial dysfunction is Guduchi. Hello. Hello.
Ah, yes, sir.
Am I audible?
Yes, sir, but
Okay.
disturbance is there, sir.
So, okay. So, do you want to mitochondrial dysfunction? So, this mitochondrial abnormality can be corrected or can be used. Can be corrected by this Agni Chikitsa and oxidative stress. Oxidative stress is see, whenever any metabolism takes place in a cell, free radicals are released. This free radicals, when they are released, it causes damage to the cell. So the cell, what it does is, along with the release of free radicals, it will also release some antioxidants also. It will also produce antioxidants. So this antioxidants, what it does is, it removes the free radicals. But in what will happen is, oxidative stress will be more, will be more. That is, presence of free radicals will be there, and increased radicals, again, it causes mitochondrial dysfunction. So oxidative stress can be better managed through Rasayana Chikitsa. Okay, it can Rasayana Chikitsa is the best scavenger of free radicals. Okay, so like this, recent advancements are there. Altered tight junctions. That is nothing but the tight junction which is there in the intestine. These junctions, what it does is, it prevents escape of intestinal secretions or intestinal fluid into the outside the intestines. Suppose if there is a tight junction abnormality, then automatically there is a leaky gut will be there, which I have explained before. And there will be structural changes in the cortex, hippocampus, amygdala, cerebellum. It should be and there is a level of, reduced levels of serum transferrin and serum ceruloplasmin. These are the proteins which are used for transfer of iron and copper, transferrin ceruloplasmin. Apart from this action, another important action of transferrin and ceruloplasmin is it removes free radicals. So it is a very good antioxidant. Whenever this transferrin and ceruloplasmin levels are reduced, automatically free radical accumulation takes place. It causes autism. So this transferrin and ceruloplasmin, as these are present in the circulation, that is in the rasa and rakta, as it is reduced, you should understand the lines of rasa dushti. Okay. So controversy regarding a gluten-free, casein-free diet. Usually, whenever whenever a child is autistic, automatically the first thing what they will do is they will stop giving gluten. Gluten is nothing but it's a protein which is seen in only 4 products will have gluten. Four food products, that is wheat, rye, oats, and barley. Wheat, rice, that is maize, oats, and barley. In this 4, only gluten protein will be there. Normally, human body will have the one enzyme called as glutenase, which will digest this gluten. But autistic children, because of genetic abnormality, doesn't have this gluten. I mean, gluten is enzyme. So gluten will not be properly digested. So when improper gluten is nothing but amam. So what it does is it stimulates a particular protein called as zomulin, and it increases the intestinal permeability. Once the intestinal permeability is increased, automatically leaky gut is there. Okay, that leaky gut. And casein. Casein is a one protein which is present in milk. When it is ingested, the protein which is there in the milk, when it is ingested, it turns into beta casomorphin. Beta casomorphin. But the actions are similar to that of morphine, ganja. Okay, actions are similar to that of morphine. And whenever a person uses morphine, automatically change the behavior. So that's why gluten in the sense it is usually common in bakery products. Okay, bakery products and casein, milk products, milk, curd, cheese, butter. Okay, so people say that whenever a child is autistic, don't give gluten, that is bakery products, and don't give milk. But recent study says that there is no much difference in giving and not giving. But it is having but don't give gluten and casein, that is don't give this bakery products and milk products only in autistic children who have digestive problems or digestive issues. Either the child will have constipation or the child will have diarrhea. Okay, the child is having these problems. For those children, stop giving this bakery products and milk. Okay. And rest of the autistic children, you can safely give this gluten and casein-free products. Okay. So coming to Ayurvedic understanding, how we can understand this autism is it should be understood on the lines of manas only. Okay, manas, it can be explained on two aspects. One is clinical level and second is on the metaphysical level or even Pathophysiology. I am very, very poor or weak in Pathophysiology. Let me explain manas in clinical level. In manas, manorogas, there are two manorogas which have been explained in Charaka. If you Charaka Nidanam, there are 8 chapters explained. The first 6 chapters, there are Sharirikam. Seventh chapter is Apasmara, which is a psychosomatry, that is a body and mind induced. And 8th chapter is Unmada. See how scientifically our acharyas have explained. Totally 8. The first 6 are Sharirikam in origin. 7th chapter is Sharirikam and Manos, that is Apasmara, and 8th chapter is Unmada. If you see, if you understand the lakshanas of autism, it matches with Unmada. And the Shrotas which is getting involved is Rasavaha and Sanyavashrutas. Okay, Rasavaha and Sanyavashrutas. And this condition, this autism, you see, is a congenital one. Right from birth, it will be there. Okay, but it is usually understood by the parents only at the end of 15th to 18th month. Only by 1.5 years, the child will start showing the symptoms of autism. Okay, but the disease will be there since birth. So as the disease is congenital, dosha vitiation is permanent. It is not a temporary one. It is a permanent dosha dushti, and this dosha dushti will be at the ama level. That is dhatu lina ama. And whenever dosha dushti takes place at the ama level, we usually call it as dushi visham. Okay, dushi visham. Okay, so the treatment of this autism is on apasmara, unmadam, graharoga, visha, and rasayana. Okay, these principles has to be explained or it has to be used in the treatment of autism. See, this cognitive pathology, that is, what do you mean by cognition? See, when you are given with any one particular thing, a particular toy or a particular food, you will first see what will the taste of the food, whether it will be good to eat or it is bad to eat, what are the complications of taking food. This understanding is nothing but cognition. Okay, this cognition will be absent in autistic children. See, whenever a child of autistic child is exposed to a particular thing, the Jnanendriyas and Karmendriyas which is there in the Shariram is getting stimulated. The child sees or experiences that one, and it influences Manas, and Manas influences Atma. This is normal pathology. When it comes to the clinical aspect, Atma will not be there. It is only Buddhi. Okay, Atma is read by the Buddhi, that is understanding or discretion. That's why in Unmadam, there is no Atma Vibramam. It is only Buddhi Vibrama is there. Okay, so this pathology, that is the problem will be there in the Manas and Buddhi in autism. See, in autistic children, the child will not be in a position to talk. When a child is not able to talk, the problem can be in the three areas. One is the Jnanendriyas, that is, the child is unable to hear or the child is unable to see. Okay. The problem with the Vakindriya. Okay, the problem with the Broca's area or Wernicke's area or even the Vakindriya, that is oral cavity. And third one will be problem with the Buddhi and Manas. Okay, problem with Buddhi and Manas. Here in autism, the defective language development is caused because of the problem with Buddhi and Manas. This is only by Vata Dushti. Okay. And the child be attentive. Many of us, we might be experienced. Now we are sitting in a class. Our body will be there in the class, but our mind will be there. Body present in much. So lack of attention. Okay. So this attention is possible only by presence of Vata. Okay. The mind is chanchala, is completely roaming. Okay. It's highly chanchala. And whenever you're listening, I mean, whenever you're in a class, you should keep seeing the presenter, that is teacher. You should keep listening whatever he says, and you need to imagine. That is, you need to assume or you need to understand what he is saying. And these three are taking place in a tandem, or when these three are taking place correctly, then only attention will be there. Suppose you are seeing, you are listening to the person, but unable to understand. Again, there is lack of attention. Okay, so these three can be in one line only when there is a Manas, and Manas is governed by Vata. Again, there is a Vatika this one. And sensory perception, that is sensory system impairment. Again, I have said in the before slides that the child will have abnormal behavior whenever he listens any abnormal sounds, normal sounds, or he doesn't allow us to hug him, cuddle. Okay, Sparshanendriyam is affected. Again, Sparsha is Twak, that is Vatika in nature. So Vatika. So if you see, all the things are governed by Vata. All the things are governed by Vata, and it is mostly of Pittanubandha. Okay. And coming to pathology of autism, what are all the causes? MMR vaccine was one of the main cause for autism, because MMR vaccine is a chemical as thiomersal, acts as a preservative, thiomersal. But now thiomersal is not used in the manufacturing of this MMR vaccine. This is iatrogenic. The second reason might be genetic, that is inborn errors of metabolism. Inborn errors of metabolism also cause autism. And before, the usual is that Garbini Paricharya. Okay, Garbini Paricharya. And care of the pregnant woman. If a pregnant woman undergoes too much of stress, that is prenatal stress, then automatically one of the cause for autism. And Gotra Sampradaya, that is eugenics, improper eugenics, and good and bad timing of co-union. Ayurveda says that Shubha Muhurta. Shubha Muhurta for union. Okay, so if that is not there, then automatically it is also one reason for autism. And there is one more condition called as infradian rhythm. This you might have heard about this. Infradian rhythm, ultradian rhythm, infradian rhythm, all these things. So these pathologies will also cause autism. I don't want to explain in detail about all these things as time is running out. And Purva Janma Krita Papam, of parents, that is eugenics and infradian, and both Padakara Bhavas, that is there are Garbhodpadaka bhavas which influences the fetal development. There is one bhava called as Matrija Bhavam, and Matrija Bhavam, Mastishkam is there. Mastishkam comes under Matrija Bhava. So if pregnant woman undergoes too much of stress, Mastishkam will be involved, will not be properly developed. Mastishkam is nothing but brain and abnormal development. And proper Garbhini Charirya, that is 4th, 5th and 6th month, Navhruda, Manas and Buddhi are formed. If there is any abnormality taking place in the 4th, 5th and 6th month, again, that is also one reason for autism. Suppose if the child is having what dosha is involved, okay, we need to understand which dosha is involved, then only we can go for proper medications. If the child is shouting, smiling, irrespective of the context, okay, irrespective of the context, it is mostly Vatanubandham, okay, mostly of Vatanubandham. And irrelevant communication. If you are asking one question and the child is giving a separate, not at all relevant answer, that is irrelevant communication, that is Vatanubandham. So in Vatanubandham, Kalyanakam, Kalyanagradam, Kalyanaka Kashayam, all these things can be given. Pittanubandham. Pittanubandham, usually children they will be adamant, okay, they will be aggressive, okay, that is called as tantrums. Nude expressions will be there, that is they will remove their trust. Nude expressions will be there. All these features will be there in Pittanubandham. In Pittanubandham, Tiktarasa Pradhana, go for Brahmi. In Kafanubandham, usually night times, the symptoms will get aggravated. Parents usually say, night time, the child is not sleeping. The child is becoming aggressive, especially in the night times. That is Kafanubandham. So in that conditions, go for Panchagavyam. Okay, you cannot give Panchagavyam in Vatanubandham. You cannot give Kalyanakam in Kafanubandham, because Kalyanakam and Panchagavyam both are explained in Unmada. But in which condition, which yoga should be given, that you should know. So in Vatanubandham, Kalyanakam is given. In Kafanubandham, Panchagavyam is given. In Pittanubandham, you can go for Dadimadi, Brahmigradam. Okay. And coming to the Shodhanam, that is Shodhanam treatment, that is Shodhanam Shamanam Davyavapashraya. Shodhanam, all this Purva Karma, all the that we need to do it. I will explain all these things in detail in the later stages. In Shamanam, always start with Rajanyadi Churnam. Rajanyadi Churnam. It is also called as Balashtaka Churnam. Rajanyadi, another name of Rajanyadi Churnam is Balashtaka Churnam, because Rajanyadi Churnam is a very good Deepana. Okay, don't go for Grita preparations or ghee preparations in the initial stage, in the beginning of your treatment, in the beginning of your prescription. Never start with Gritam, because there is amam. In amavastha, don't go for gritam. That is Rajanyadi Churnam. But one complication of Rajanyadi Churnam is it contains Haridra. Haridra is Grahi. It causes Shoshanam. So children who have constipation, whenever you give Rajanyadi Churnam, it aggravates. Okay, it gets aggravated. The constipation will get aggravated. Stools will become more dry. Don't go for Rajanyadi Churnam when the child is having constipation. So in that condition, you can go for Gandharva Hastadi Kashayam, or you can go for Guduchi Adi Kashayam, or Guduchi Sattva. Because Guduchi is and Gandharva Hastadi, again it's Amapachanam, Deepanam, Vahnikaram. Rajanyadi is also having same, but the difference between Rajanyadi and Gandharva Hastadi is Rajanyadi is Shoshanam. So Rajanyadi will be a very good drug if the child is having loose stools. But if the child is having hard stools or constipation, go for Gandharva Hastadi. And Daiva Vyapashaya Chikitsa, that is Gayatri Mantra Japam, Mrityunjaya Mantra Japam, all these things can be done. And coming to the different panchakarmas, what I usually do is Abhyangam. So there are many tailas explained in Ayurveda. Dhanvantara Tailam, Lakshaya Tailam, Mahamasha Tailam, Prabhanjana Tailam, Mahana available in the market. Clinical practice also. In which condition, which Taila has to be used? We cannot do inky, pinky, ponky and select a Taila. There should be some logic behind selecting a Taila. You can select Lakshaya Taila whenever the child is having hyperactivity. Whenever the child is having hyperactivity, that is the Chalaguna of Vata is getting aggravated in the child. Whenever Chalaguna is aggravated, the opposite guna is Thiraguna. Laksha is Thiraguna. There you can go for this Lakshadi Tailam. Okay, so Lakshadi Tailam will be better in cases of hyperactivity. Mahamasha Tailam. See, Mahamasha is a Brahmana Tailam. Okay, Mahamasham is a Brahmana Yoga. See, whenever the child is Krusha, he is very, very lean, Shushkata, in those conditions, you can go for Mahamasha Tailam. Dhanantar Tailam, you can select normally. In normal conditions, you can select Dhanantar Tailam. It's a safe one. You need to do Nadi Swedam and Patrapinda Swedam. Okay. But in my experience, what I have found is some children, they will not do this Nadi Swedam. For Patrapinda Swedam, they will be happy whenever you do Patrapinda Swedam. And there is one procedure called as Talam. That is called as Talam, you might be knowing. It is also called as Shiro Pichu, or paste applied as a pichu over the head. Okay, Brahmaranda, that is on the head. There is one churna available in the market. Kotakal Pharmacy prepares that one, called as Panchagandha Churnam. It contains Manjishta, Shariba, Ananta, all these Pittahara Dravyas. Panchagandha Churnam, you mix it with any Tailam, or depending upon the doshic involvement. If you suspect there is more involvement of Vata, hyperactivity is there, you can add Dhanantar Tailam. Suppose if the child is shouting, if the child is aggressive, I have seen one child wherein the child starts beating himself. That is called as self-beating. How a chimpanzee beats herself, that is chest thumping will be there. The chimpanzee does this chest thumping. Okay, beating the chest. Okay, that is an aggressive behavior. Some children, they will start biting. Okay, that is biting themselves. They don't have pain. The pain perception they cannot, they don't understand. Okay, because of that irritation in the brain, they hurt themselves. That is one thing which is very, very pathetic in autism. They will not be hurting other children, they will be hurting themselves. So that is a Pittanubandha. So in those conditions, this Panchagandha Churnam with Himasagara Tailam. Okay, Panchagandha Churnam with Himasagara Tailam. If the child or if the parents are complaining that the child is not sleeping properly, same Panchagandha Churnam and aggressive behavior is there, Himasagara Tailam or Dhanvantara Tailam, at that time you can add this Jata Mamsi. Okay, Jata Mamsi Churnam. All these things mixed together, apply as a paste and apply in a form of a small size on the head of the child. Take my word granted, by third day, the aggressive behavior will come down. It is a damn sure treatment. Panchagandha Churnam with any Thailam, Vatahara Thailam or Pittahara Thailam, depending upon the doshic involvement. And the next thing treatment is Takradara. By doing Takradara, definitely the ingredients is usually Musta, Amalaki, Ashwagandha, and Jata Mamsi. I'm not going to be explaining the details of Takradara, but it is a very, very good treatment in the management of autism and all psychological disorders. All psychological disorders, Takradara. Okay, so Musta, Amalaki, Jata Mamsi, Ashwagandha, Jata Mamsi. By fourth day to 1 week, by maximum 1 week, definitely the child will have increased eye contact. There will be improvement in the eye contact by doing just Takradara. Here Takradara, I mean both Shirodara and also Sarvangadara. Okay, Shirodara and also Sarvangadara. Again, Matravasti, you can select Panchagavya Kritam, Kalyana Kritam and Brahmi Kritam. Kalyana Kritam in Vatanubandham, Brahmi Kritam in Pittanubandham, Panchagavya Kritam in Kafanubandham. Panchagavya is Gomutra. Gomutra is Tikshna. So when it is Tikshnam and Ushnam, it should be given only in Kapha. So you remember this one. Okay. So once you remember Panchagavya, automatic is in water. Okay. So Brahmi Kritam, Tiktarasa Pradana, you can give it in Kafanubandham. Matravasti, you can safely give even for 1 year child. I have given Matravasti even for a 1 year child. Less than that child, less than the age of that 1 year, I have not tried giving Matravasti. Matravasti can be given. Okay, safely given. The maximum dose which can be given for as a Matravasti for a 1 year child is 15 ml, not more than that. Okay, for a child, the maximum, that is 5 years, 6 years, 7 years child, the maximum dose of Matravasti is child crosses more than 40 kgs, then you can make it as a 40 ml. Okay, but the problem here in Matravasti is there is an improvement in eye contact. Whenever you are giving Matravasti, eye contact will be improved. But if the child is having GI disturbance, that is either constipation or diarrhea or whatever with it, or tantrums and excitement is getting aggravated, the symptoms are getting aggravated, okay, by giving Matravasti. And Mrudu Virechana, you can simply safely give Mrudu Virechana or Nitya Virechana, simple Trifala Churnam or Trivrit Churnam, or many patent medicines are available in the market. Anuloma DS, patent medicines, half tablet you can give on a daily basis. Mrudu Virechana. There is an improvement in the imitation response. That is, the child will imitate that echolalia will be improved. And I usually add this Vilvadi Gulika. In Agadha Tantra, you might have studied about Vilvadi Gulika. You might have even studied the sloka of Vilvadi Gulika. If you see the Falashruti of Vilvadi Gulika, it is given in Ama conditions, that is Vishuchika Agnimadhyam, and also in Visha, that is Dushi Visha and Garavisha. In this Dushi Visha and Garavisha, Vilvadi Gulika is explained. Okay, if you see, Vilvadi Gulika is having these two conditions, that is Ama and also in Visha. In Ama Avastha, you need to go for Ushna Chikitsa, that is Deepana Pachana Ushna Chikitsa. Whereas in Visha, you need to go for Shita Chikitsa, that is Shita Jala Sevanam, Shita Shita Chikitsa, Shita Virya Dravyas. Okay, in Vishak. The same yogam, without changing the anupanam, you can give it in two different contrast conditions, where when one condition you need to go for Ushna, and another condition you go for Shita. Okay. So like this, there's only one medicine in Ayurveda, that is Vilvadagulika. Even Chandra Prabhavati can be given. That is in Prameha it can give it. That is Mutra Ati Pravrati it can give. And also in Mutra Krisham, that is Alpa Pravrati. But there you will be changing the Anupana. You will be changing the Anupana. Okay. Kataka Kadaradi Kashai. And here in Mutra Krisham you will give Purnavadi Kashai. But here, without changing any Anupana, you will be giving this Vilvadagulika. That is contrast mediums. There's one concept called as neuronal migration. By 12th week of intrauterine life, from the ectoderm, okay, ectoderm, endoderm, mesoderm, in the embryonic staging, from the ectoderm, nervous system develops. Nervous system, that is from the ectoderm, a single neuron is formed, and this neuron, it travels to the periphery of the body. It is called as neuronal migration. It moves, it travels. One neuron, it keeps on attaching to different neurons, and it keeps on changing. I mean, it end of the brain. Okay, this is called as neuronal migration to the periphery of the brain. Okay. So this neuronal migration starts at 3rd month of life, and it usually ends at 5th month of life. And you should remember that for the proper stimulation of neuronal migration, there should be contrast medium. I will tell you one example. You all might have gifted many toys for the children. If you see those toys will have different colors. For example, a single toy, for example, a Barbie doll. Okay, the dress frock of the Barbie doll will have a bright color. The face of the Barbie doll will have a different color. In the same toy, that is in one toy, you will have 4 to 5 different colors. When the baby keeps on looking at those different colors, contrast colors, like an old movie hero and heroine, those contrast colors, then automatically it gives some visual stimulation. It's called as chromotherapy. Okay, see how scientific the toys are. Even the toys will just think that it is, but it helps the child. So this contrast medium is always helpful for the proper development of. The same concept is followed here also, because Vilvadagulika is a yogam which is having a contrast actions. Same yoga can be given in Ushnavirya as a Ushnavirya, and the same yoga can be given as a Shita Virya also. That is in Vishuddha and also in Dushi Visha. So what I usually do is Vilvadagulika, 1 tablet of Vilvadagulika, I'll make it as a powder, mix it with Vasti Dravya and give as a Vasti. Take note, it's a very good practice. Okay, you can even give Vilvadagulika, make it as a powder, add a bit of water, make it as a Swarasam, and you can give it as a Nasyam also. Nasyam also. Okay. So this is about the neuronal migration, which I have said. See, this is the what to say? See, this is the ectoderm. Okay, this is this area. This half crescent shape is ectoderm. From ectoderm, the neurons, it keeps on traveling, and this is the periphery of the brain. So this procedure is called as neuronal migration. The traveling of the neuron from the ectoderm to the periphery of the brain. The contrast stimulus. Okay, the toys are the very good contrast in the chromotherapy. Is also a very good for contrast. Hello. Am I audible?
Yes, sir. You're audible.
Okay. There's not too much for you. Hope. Okay. Yeah, this I will tell you my experiences. These are the drugs which are practiced in the last 14 years. Shankapushpi Moolam. Shankapushpi Moolam is cooked in milk. That is, it is boiled in milk, and when it is given, it improves eye contact. As many of us are practicing in urban areas, we cannot go in the forest and get the Shankapushpi Moolam. You can go for simple Shankapushpi Spasam or Shankapushpi syrup. Shankapushpi syrup, many pharmaceutical companies prepare Shankapushpi. That can be given as a single drug which improves eye contact. Okay. Brahmi Panchangam. Brahmi Panchangam again. You can give simple Brahmi with butter and it reduces screaming. That is, the child will stop screaming. Okay, Pittanubandham, screaming. Okay, Brahmi. When you don't have Brahmi, you can go for Brahmi Swarasam. Brahmi Girtam is usually not advised in the initial phase. You can go for, because Girtam is Mandekam, because of Andhra Guna and Pitta Guna. So here you can go for Brahmi Swarasam, or even if you don't have Brahmi Swarasam as it is, you can go for Brahmi Vati. Brahmi Vati is available in the market. And give this Brahmi Vati, when you give, it reduces screaming. Shweta Aparajita Moolam. Aparajita, again, we need to go in the forest to get this Aparajita, but it's a small plant which can be cultivated in our clinic itself. This one, it reduces hyperactivity. But remember one thing, hyperactivity can be reduced by doing simple abhyangam with a Dhanvantara Tailam or Lakshadi Tailam. If you don't have Aparajita Moolam, forget it. You prescribe 1 bottle of Dhanvantara Tailam to the parent and ask the parent to do abhyangam twice a day, followed with hot water bath, and by 1 week, hyperactivity will reduce. Okay. And to improve the speech, what we usually do is Vacha Churnam with Rudraksha Churnam. Rudraksha, again, it is not available in the market outside. You'll get this Rudraksha seeds and you need to powder it. Vacha Churnam and Rudraksha Churnam. That is, you can add 20 grams of Vacha Churnam. You can note down. You can add 20 grams of Vacha Churnam, 50 grams of Rudraksha Churnam, and you can add even Yashti Madhu Churnam, because Yashti Madhu is a very good dravya in dyslexia. And improving the understanding of reading, writing. So you can add this Vacha, Rudraksha, and Yashti Madhu. Okay, and it is very good in improving the speech. And many of the patients, around the 70 to 80% of the autistic children will have inborn metabolic error. So in those conditions, simple Bilva Panchangam. If you don't get Bilva Panchangam, don't get worried. You can give simple Vilvadi Gulika. Simple Vilvadi Gulika, 1 tablet morning and night before food or after food. Okay, it's a very good medicine in almost all inborn metabolic errors. Vilvadi Gulika. And Jata Mamsi Kashayam. Here I'm giving it the form of Shita Kashayam. Jata Mamsi Shita Kashayam. It is a very good drug in tantrums and compulsive OCDs. But I have always, I also give Jata Mamsi as a normal Kashayam, freshly prepared Ushna Kashaya in muscular dystrophies. It's a very good muscle relaxant and it induces sleep. So Jata Mamsi is a very good medicine. Both can be given as it is given as in a Shita Kashayam form and also in Ushna Kashayam. Shita Kashayam, it is a Pittahara. In Ushna Kashayam is a very good muscle relaxant and Nidra Janam. The Draksha Samangadi, Draksha Madhukadi and Bala Kanaka Patradi, the reference is in Arogya Raksha Kalpadrumam. There's one textbook. It's in actually Malayalam textbook, but it is the English translation is available. It is available in Chaukamba. You can get that one. It's a very good textbook for pediatric usage. Draksha Samangadi, Draksha Madhukadi, and Bala Kanaka Patradi. Unfortunately, these three medicines are not available in the outside market. We need to prepare on our own. When you have our own. So this is a very good yoga. It is given in these conditions. Gandharvastadi Kashayam. You add this Gandharvastadi Kashayam with Panchalavanam. Okay, Panchalavana and a pinch of Hindu. Gandharvastadi. This is a very good yoga in almost all food allergies. Whenever autistic children is having food allergy, in those conditions, you can give this Gandharvastadi with Panchalavanam and Hindu. This Patola Katrohinadi Kashayam, you might have heard about it. It's a very commonly used Kashayam, Patola Katrohinadi Kashayam. When you give this Patola Katrohinadi Kashayam, the child will follow the command. The child follows the command, which is usually not there in autistic child. The autistic child will not understand our commands. He will not understand. But when you give Patola Katrohinadi, he will be understanding your commands and follows. Okay. And Kadiradi Gurika, they will usually autistic children, they will use abnormal facial oral movements. For that, abnormal facial oral movements, you can give this Kadiradi Gurika. This Ashtachurna, you all might have heard of this Ashtachurna. I will tell you one example or one experience. My usual treatment always starts with one Rukshanam and then only Snehanam. I will start with Podikiri or a Churna Pindasvedam and then go for Snehanam. For one child, I thought that no need of doing any Rukshana Kriya. Directly I will go for Snehana Kriya. So I started Abhyangam. On third day when I went for rounds, the child developed a special complaint called as I said before, chimpanzee, chimpanzee does just thumping. Okay, like that the child started this self-beating. Okay, and flapping, hand flapping will be there. So for that, this Ashtachurnam, you can give it with any Gritam, that is either Kalyanakam, Doshika involvement, either Kalyanakam or Panchagavyam, you can give and give it Ashtachurnam, and within 10 days or 1 week to 10 days, the self-beating and hand flapping will be reduced. Okay, and you can give this Dadimashtakam, GA disturbances, Saptamrutam, that is there will be a hyper-excited in autistic and ADHD children. So for them, the Saptamrata Loham, you can give it with Kshiram. Okay, and like this Kushmanda Rasana, you might have heard about this. Kushmanda Rasana is a very good condition in impaired cognition. That is, when you are giving any task or when you are giving anything for the child to eat, the child should understand what it is. The child should know what are the benefits of it. This condition is called as cognition. The cognition will be impaired in autism. So for that, you give this Kushmanda Rasayana. Manasamitra Vataka. Usually autistic children, they keep on looking at only one direction. They keep looking at the sky or they keep looking at the down or a single gaze. They keep on looking at one particular view only. So that will be reduced by giving Manasamitra Vataka. And Guluchadi Kashayam, when you give Guluchadi Kashayam, the basic requirements, that is the basic understanding of himself, that is routine activities, that can be taken care of by giving Guluchadi Kashayam. So all these things, these are all my own practical experiences of around 13 to 14 years. Okay, each yoga I have observed and have understood. Okay, and coming to this, realizations from my experience, there's one sloka called in Ashtanga Hridayam, that is Abhyasat Prapyate Drishti, Karma Siddhi Prakashini, Ratnadi Sadasa Jnana, Na Shastra Deva Jayate. That is, it is just not reading about the text, reading from the textbook. We need to understand even from our experiences. Okay, so my experiences, what has taught me is, you need to be a child to treat a child. You forget that you are a doctor. You have to be a child to treat a child. Contrasting chikitsa procedures, that is 2 days, first 2 days Rukshana, Churna Pindasvedam, next 2 days Abhyangam, next 2 days again Churna Pindasvedam, next 2 days Abhyangam. So this contrasting chikitsa procedures gives better results. You come out of the routine prescriptions. Whenever a child comes with some psychological abnormality, don't start with Ghritam, don't start with Kalyana Ghritam, Panchagavya Ghritam. Okay. Come out of the routine prescriptions, understand the condition, and parents are the captains of the ship. The role of treatment is based on the parents' attitude. Advise them, counsel them that parents need to be careful. They need to be little patient. Our role is only minimal. Doctors, speech therapists, behavioral therapists, these rules are very, very minimal. Parents' role is maximum. So parents are the captains of the ship. And every autistic child is unique. We cannot tailor-made a prescription for autism. Okay, they are unique. Every child is unique. And our approach should always be to unlearn to relearn. You might have heard, you might be knowing something, but you remove that one. And lastly, and I need to, I wish to the little hearts who are inspired to do some work on autism. Thank you.
Thank you, sir. Thank you for most informative questions, sir. There are a few questions, sir. Shall I take them?
Yeah, please.
What is the role of Swarna Prashana in the treatment of, in the management of autism?
Role of Swarna Prashana. Okay. Swarna Prashana is having a positive role, is having a very good role. The Falashruti of Swarna Prashana is the Dhriti, Vibrama, all these things are will be having a positive role. You can safely give Swarna Prashana. But whenever you are giving in the form of mixing with Ghritam, think about the Agni. Think about the Agni. Okay, because even Swarnam is available in the form of even in Brahmivati. In Brahmivati, Swarna is there. Okay. In Saraswata in few pharmaceutical companies, that is Vaidyaratnam and Kotakal, they prepare Saraswata with gold. So Swarnam, it can be given. It is safely given. But whenever you give it in the form of Ghrita base, you think about Agni, because Ghritam is Pichila Swabhava. It can complicate the existing Amavastha.
Okay, sir. Then we can use Swarnavacha safely, no? Without...
Yeah. Safely you can.
For how many days you recommend Swarnavacha for pediatric?
In Karnataka, is usually given only on the Pushyami Nakshatra. Okay. In Karnataka, it is widely practiced prescribing only on Pushyami Nakshatra. That reference is given only by Sushruta, but no other acharyas have given, have recommended giving the Swarna only on Pushyami Nakshatra. In my opinion, I usually prescribe Swarna continuously for a period of 14 days. I will give a gap of 14 days, and again I will start 14, because it is bit costly also. We need to see the pockets of the patient also, parents, because when they come to us, they might have emotionally and financially drained. So we cannot. So 14 days you can give a gap of 14 days, and again you can start the stream.
Okay. So this Bilvadi Kutika and these medicines, for how long we can prescribe safely?
There is no time period for prescription. That is only for this time you can give, because Bilvadi Gulika is a Kashtaushadhi. There is no problem in that. you can safely prescribe Vilvadi Gulika for a number of days. But in my opinion, whatever the prescription is there, you keep changing every 14 days to 1 month. You give a break, because the body gets accustomed to that particular drug. 14 days you give, stop Vilvadi, you can start another yoga depending on how the child is reacting, and then we can come back to the Vilvadi. That's why I usually, my Grita preparations will be only for 15 days maximum. Because when you give for more than 15 days, again, Agni Amam will be there. So 15 days I'll give, and then I'll go for Churnam, Rajanyadi Churnam. And then once Rukshata is slowly increasing, I will stop this one, I will add Grita. So it's like how we weigh this weigh mission. Like we'll put something here on one side and remove something. Like this, we need to balance and we need to see.
Sir, another question, sir.
Yeah.
Sir, you were explaining about the gluten diet. You mentioned 4 gluten contents. What barley and which is another one, sir? We didn't hear it clearly.
Okay. Wheat, barley, oats, and there's one food substance called as rye, R-Y-E.
R-A-Y-E.
No, R-Y-E.
Okay.
R-Y-E. And even in maize, gluten is there. And usually our practically gluten is seen only in the bakery products.
Okay.
Bakery products, and nowadays there is a fashion of having oats meal as a breakfast for slimming. Okay, oats contains gluten, and maida, what we usually do for this cake, maida usage at home, maida contains gluten.
Okay, sir. Another question, sir. So what is the role of Takradara in the management of autism? How it will act?
See, any Dara, we need to see on 2 modes. That is on the Shirodara, and second one is Sarvangadara. On Shirodara, autism is a mood and behavioral disorder. Okay, for mood and behavioral disorder, neurogenic transmitters are usually excessively secreted. For example, serotonin, acetylcholine, these are increasingly secreted, and there is an abnormality in the functioning of amygdala also. So whenever you are giving this Shirodara constantly on a particular part of the brain with a particular force, what it does is it stimulates the brain functions. So it alters the secretion of this unwanted neurochemicals. So the mood behaviors will be altered, will be changed.
Okay, sir. Okay, sir. Thank you, sir. These were the questions, sir.
Okay.
Just before concluding, let me convey the vote of thanks, sir.
Okay.
First of all, I would like to thank SVM board members and management of SVM VV Sangha Ilkal for their encouragement and support in conducting these webinars. I also thank today's guest speaker, Dr. Udaykumar, sir. So we are very much grateful for the time and the effort you took in sharing your knowledge and experience with us, sir. And I'm also thankful to Dr. K.C. Das, Principal, SVM AMC Ilkal, for his constant support and guidance in arranging these webinars. I also thank Dr. Krishna Jiblu and Dr. V.P. Hiremat for their support in organizing these webinars. And I also thank all the participants who all joined us today to the Zoom meeting and who are watching live on YouTube. So thank you one and all. Thank you, sir.
Thank you.
Shall I close?
Yeah, please. Thank you.
Thank you.